Good morning and welcome to Seeking Wellness on WPKN 89.5 FM. I'm your host, Dr. Jennifer Pierre, your neighborhood naturopathic doctor and public health advocate. If you're a longtime listener, welcome back. If you're new to the party, come on in, take off your shoes, and get comfortable. We are broadcasting live from Bridgeport, Connecticut. If you've missed any of our past shows, please log on to our website, wpkn.org, to explore our archives and podcasts. Here on Seeking Wellness, Our Bodies Explain, we discuss the trending health topics by clarifying some misconceptions and providing education from a naturopathic perspective. Today on the show, we'll be talking about depression. What it is, how it affects us, medications used, and also some natural therapeutics. Depression, especially around this time of year, is known as the winter blues. The holidays are supposed to be the most wonderful time of year. However, for many people, the holidays can be associated with old memories, reminders of family members who have passed away, and feelings of isolation. For those prone to depression, the holidays can trigger feelings of sadness. Furthermore, it doesn't help that it's the darkest time of the year. The days are shorter, sunlight is scarce, especially if you're living in the Northeast like most of us listening. Many people with depression find mornings to be the hardest part of the day. When we're talking about depression in comparison with anxiety, I like to think of anxiety as anticipation about the future, while depression is looking back on your past. And it becomes extremely important to stay in the present to basically avoid either of those areas. Depression causes you to think about all that's gone wrong, to kind of ruminate on your past. And as I mentioned, one of the reasons why I wanted to talk about this show today, this topic, is because many people are expected to be very joyous and joyful around this time of the year. And if they're not, they can be accused of being a Grinch or something's wrong with them. Many times it just brings up sad feelings, but other times it can be even worse and a person can be clinically depressed. So it's very important to keep an eye on your loved ones and notice any changes that seem out of the ordinary compared to how they normally are. The holidays are synonymous with trees and gifts, and there are certain people who don't have that strong family ties, and that may cause them to be triggered into a moment of depression. Depression is actually not uncommon. In 2017, the World Health Organization classified depression as the single largest contributor to global disability worldwide. The single largest contributor. 7.5% of all the people studied were living with a disability, and that's what they use as their marker. And overall, 300 million people worldwide are affected. It is estimated that the prevalence has increased to over 18% just between 2005 and 2015. In 2008, the World Health Organization ranked major depression as the third cause of burden of disease worldwide and projected that the disease will rank first by 2030. Major depressive disorder is common, with almost 1 in 5 people experiencing one episode at some point in their lifetime. Hence, in primary care, which is what I do, 1 in 10 patients on average presented with depressive symptoms, and that's according to an Australian study that was done. Although major depression is more commonly seen in mid-adolescents to people in their mid-40s, almost 40% of those people experience their first episode of depression before age 20, and the average age of onset in the mid-20s. It's almost twice as common in women as it is in men, and that's mostly due to the biological and psychosocial differences and environmental factors. So by that, many times hormonal output is also involved with that, and that can be mixed with general symptoms of depression. Once you've actually had a major depressive episode, the likelihood of recurrence is high, and older age of onset is less favorable. Now, I wanted to talk about this topic because I feel like it's the elephant in the room. It's something that's coming up almost every time I have a day that I'm working with patients. And sometimes people don't want to talk about it because either they don't want anyone to feel sorry for them, or sometimes they're not even sure if they're going through a depression. And as I mentioned before, because this time of year is supposed to be happy, they don't want to talk about it or bring other people down. But it's important that we talk about this topic because it's very often misdiagnosed. And the more we talk about things that are uncomfortable, the more we can get a little bit comfortable with them. And the fact that it is so common is also a reason to discuss it. And this show is not meant to be depressing. This show is meant to give you a little bit of background into what depression is, how it's classified, what is the definition of it, how you can figure out if you are actually depressed, and how to get help finally. There are many resources available for depression, and that can be in the form of counseling, medication. There's also some natural treatments that are very helpful for depression. So it's very important that we get all this information out there so that you are informed and know what is available for you to use. So, what exactly is depression? How do we classify it? There are two main classification systems used to categorize depression. That is the Diagnostic and Statistical Manual of Mental Disorders, known as the DSM, and the International Classification of Diseases, known as the ICD. Many people are familiar with ICD. Those are those ICD codes that are used in many different conditions and disorders and diseases that you would hear about from your primary care physician or any other physician that you're seeing. Those codes are used for billing, and they're commonly mentioned. The DSM is discussed more in relation to categorizing mental health disorders. It was created in 1952, and the DSM is constantly updated to reflect ongoing research on mental health disorders. In 2013, the DSM-5 was created, and it was meant to include certain things that weren't previously included in the DSM-4. In the DSM-5, it included subtypes for certain disorders. So it got a little bit more particular into how mental health disorders, the different nuances of mental health disorders. According to the DSM-5, for a diagnosis of major depressive disorder, and we'll be focusing on that the most in this discussion today, for that diagnosis, the individual needs to present with 5 or more of any of the symptoms nearly every day during the same 2-week period, provided that at least one of these symptoms is a fundamental one. Sleep, weight, and appetite are usually diminished in depression, but other times it can be increased. Many times suicidal ideation and plans are present, and that's important to document for the physician. And just listening to some of the things I discussed as far as in the diagnosis, you can see how it's difficult to categorize depression. Changes in sleep, weight, and appetite are pretty common in many health conditions. So how do you know when it's actually depression? Many of these symptoms are present in so many other pathologies. So it's often missed and misdiagnosed in primary care visits, especially when you think about the reality of how much time is actually spent in primary care visits. For the most part, anywhere to 10 to 15 minutes max is what a general primary care visit entails. So in that short bit of time, how can you really get a good diagnosis on whether this patient that's presented to you is dealing with depression, anxiety, any of these mental health disorders, it is really important that the physician is able to see these signs, assess the patient, and also refer to a psychologist or psychiatrist if any of these symptoms present themselves. Anxiety is commonly discussed in the context of depression, and almost two-thirds of individuals with major depressive disorder have clinical anxiety that can actually present 1 to 2 years before the onset of depression. So imagine that. We're talking about depression, but many people suffer with anxiety before that time period. So when does it go from anxiety to depression? Obviously, you have to pay close attention to your symptoms, and hopefully you have a primary care physician that is noticing those changes, and they can only notice that if you're sharing some of the feelings that you're having. So if you're having a depressive episode that seems a little longer than usual, it's important to discuss that, share that with a family member. If you're a family member that notices those changes, from a family member feeling anxious and then suddenly shifting, that's a very significant change that needs to be discussed. The length of time to diagnose depression is in particular of importance because there's also adjustment disorder and bereavement, and they present very similarly to depression. Adjustment disorder can be a time period of depression where there's a particular situation. So the person could be moving, they could have lost their job, and that can trigger a state of depression. Bereavement, dealing with the loss of a loved one, can cause people to go into a depression as well. And it honestly is really, really difficult to figure out how to separate what can be grieving with depression. And honestly, they're interconnected. Depression can make it very difficult for people to think clearly, maintain concentration. Some people even demonstrate memory lapses. Longer periods of depression that can be not as severe as we're going to call it MDD, major depressive disorder, can include what's known as dysthymia or persistent depressive disorder. Now, with dysthymia, the symptoms can vary. They can be mild, moderate, or severe. And because of this, the hallmark feature is that length of time. If it's just years on end where the person vacillates between the different stages of depression. In children, what's interesting is that there's a different way to categorize. And for children between the ages of 6 and 10, it's actually known as disruptive mood dysregulation disorder. Very similar symptoms to major depressive disorder in that the hallmark symptom is very severe non-episodic irritability. And in this particular condition, children see faces as hostile. You have to rule out temper tantrums in this situation. So this isn't just that irritable child. This is a very severe expression of not only anger, feeling irritable, but sadness as well, which is why they call it a different name in between these two ages. Now, in the patient visit, what are some of the tools used to analyze whether your patient has depression or not? And this is important, I think, from the aspect of the patient to our listeners. What tools are used by physicians to try to see if you have depression? One of the more popular tools is known as a patient health questionnaire, and there are different ones. In particular, for depression, it's called the PHQ-9. And doctors can use this to ask their patients if over the last 2 weeks, how often have they been bothered by any of the problems? And it's broken down into not at all, several days, more than half the days, and nearly every day. We're going to just go through some of those questions that a physician can ask you, or even what you're thinking, because you can have access to this questionnaire as well. You can just do a search on the PHQ-9 and look at the questions for yourself and see if anything stands out. One of the first things is little interest or pleasure in doing things, feeling down, depressed, or hopeless, trouble falling or staying asleep or sleeping too much. Obviously, this needs to be looked at if there's an issue of just avoiding sleep, or if you're oversleeping just because you're tired. There's many people who work the third shift and their sleeping is out of whack. So, you have to really see, is this an issue of depression, or is this just I'm tired and I haven't had enough sleep? Feeling tired or having little energy, poor appetite or overeating. I think some of the next few questions hone in a little bit more on the possibility of depression. Feeling bad about yourself, or that you're a failure, or that you've let people down. Staying in that state of feeling really bad about yourself, thinking about being a failure, something that could have happened that didn't work out for you, and just ruminating on that, really staying in that place of, I should have done it this way, and why am I always messing up? That can definitely trigger feelings of depression. Trouble concentrating on things such as watching TV, reading the newspaper, sometimes even moving or speaking slowly, where someone may have noticed that change in your family. So if someone has been very vivacious and vibrant, and all of a sudden their pace just kind of slows down, what could have caused that? And finally, and definitely more worrisome, is thoughts that you'd be better off dead or hurting yourself. That is definitely something that needs to be looked at with a physician and assessed. And I'm going to mention some crisis numbers at the end if you are listening and you have actually felt that way. It's very important that you reach out and try to get help. I mentioned earlier that this time of year can bring on feelings of depression. This is less serious than some of the other forms of depression that I just spoke about. Seasonal affective disorder, also known as SAD, is a lot more commonly discussed nowadays. Many people will say things like, oh man, there's no more sun. I'm feeling a little down. I don't feel energized. I just want to lay in bed. That's pretty common, especially with people in the Northeast or the Pacific Northwest. Not having much sun can definitely be a mood downer. And seasonal affective disorder is categorized as recurrent depressive episodes that occur yearly in the fall or winter and actually remit in the spring. So how you can separate this from typical depression is that it's only in this particular time period. And many times people come out of it once the springtime comes, they start seeing the flowers coming out, things are blooming, the sunshine comes back, and they tend to be okay. Totally different than depression, where it doesn't matter what time of year it is. People are still going to feel down. They're still going to feel unmotivated. And there's a perpetual sadness that just stays around. Although SAD, we're going to call it SAD, is not clearly understood, one theory is the absence of sunlight and how that affects imbalances in how melatonin is secreted. The symptoms can come on gradually, and they include sadness, withdrawal and apathy, irritability, sleep disturbances. So someone who's sleeping more and still wakes up feeling unrefreshed, decreased physical activity, weight gain, and increased appetite. Like I mentioned before, some of these symptoms sound vaguely familiar with other conditions. So these symptoms also would go along with this idea of having the depressive episodes. And if you're noticing every year that this happens, you probably are subject to seasonal affective disorder. Treatment for seasonal affective disorder is very limited because scientists are still trying to understand how it works. It's very unpredictable. trying to find ways of understanding why does this only happen to certain people this time of year. So some of these things are definitely theoretical and trying to do more studies to get clarification. But one treatment that is used is light therapy. And this is done with sun lamps. So you can purchase these sun lamps on Amazon. They're readily available. And the idea of the sun lamps is to stimulate the brightness of the sun as it is at noon. You're supposed to use the sun lamp every day in the morning for 30 to 45 minutes. If you're considering buying one of these lamps, the recommended I'll say dose is 10,000 lux is how it's described. LUX, and it's important to purchase one that filters out UV rays. So since it's simulating sunshine, you have to make sure that you purchase one that filters out the UV rays. Otherwise, then you'll be at risk for being exposed to the UV rays. Blue light lamps are also used to improve energy levels, alertness, and improve mood. And the manufacturers of the blue light lamps recommend just 20 minutes a day to achieve these effects. I myself was interested in purchasing one of these lamps because I've heard many good things about them, how they're energizing and how you use them. And it makes it easier to get out of bed in the winter. It is so hard for me to get up in the wintertime with the lack of sun. I love the sun. It is very energizing for me. And with the wintertime not having as much of that, with many people, you just don't feel as motivated to get up. I used to live in Arizona years back, and it was so easy to just get up and get about because that sunshine just keeps you moving throughout your day. And then when you wake up and just have that flash of sunshine, it just feels really, really good. So these sun lamps can be a way of recreating that experience of being on potentially a Caribbean island or someplace else that's hot, maybe the west coast of the country. And a poor man's way of doing this can be just turning on more light as soon as you wake up in the morning. So the brightest light that you can, just turn it on and see how that affects you. That may help you get up a little better. I know it's worked for me. So we've been talking about depression, what it is, how it's categorized, the DSM-5 that's used to describe the how it's actually categorized. So the DSM-5, we've been talking about that. We've talked about the ICD-10 codes, where we are now, and how physicians use that to describe their patients who may be suffering from depression. And also, I went through the patient health questionnaire that you yourself can use to see if you're suffering with symptoms of depression. So now let's move on to some of the theories about depression and what it is. So we hear so much about depression, but how has depression evolved over time? How have scientists looked at depression to kind of get an idea of what is actually going on in the body? One theory is that low mood, having an actual low or depressed mood, is an adaptation. And that adaptation is created because of a life goal that could not be achieved. And then the person now goes into a state of disengagement. So just not wanting to feel involved with anything. Clinical depression usually results from some sort of dysregulation, chronic overactivation, or inappropriate evocation of mechanisms in the mood or the affect system. So again, this adaptation where somehow the brain and the body gets dysregulated. So this chronic overstimulation somehow pushes this person over the edge to where they lose their joie de vivre, so to speak, just feeling excited about life. And to cope with these threatening life obstacles where there's no flight possible, the person goes into a state of depression. So we know about the fight or flight system that the body has, the sympathetic nervous system, and the parasympathetic nervous system. So the sympathetic nervous system is where we get our fight or flight response. So they always make the example where you're being chased by a bear, you run and you get out of the way of the bear. For some reason, after a certain amount of time, the body keeps going through this. Sometimes that the person with depression feels like that flight is not possible. And as a result, they disengage. The problem is this theory of adaptation doesn't explain why some people are susceptible to depression while others are not. So it sounds good, but why are some people susceptible and other people aren't? So there's now a growing body of research that is demonstrating that the endogenous, which means internal, opioid system is more involved than previously thought. And this interconnects with the growing crisis in our country. So there are opiate receptors all over the brain. And when discussing depression, we're taking a look at some of the neurotransmitters in the body and understanding how the body works with these neurotransmitters is giving us more information about why depression happens. So this research is ongoing, and the more we look into how these neurotransmitters work, the more we can get a better understanding. So now I'm going to shift into some of the medications that are used. And some of these medications might be very familiar with some of you who have either been on these medications or have a family member who's on these medications. And there's a lot of research that needs to be done on these medications as well. And to be honest, depression is an area that's not really well understood because the brain isn't really well understood. So these medications are attempting to fix or kind of work with potential changes in neurotransmitters to provide relief for people suffering from depression. But obviously, they're not perfect. So I'm going to explain some of the commonly used medications and then also how they're supposed to work. So a monoamine is a term that refers to neurotransmitters and neuromodulators like dopamine, serotonin, and norepinephrine. So we kind of talked about neurotransmitters a little bit. And when I talk about the fight or flight system, these are some of the neurotransmitters that we're pretty comfortable with now. We're used to those things. Those neurotransmitters give us a little drive when we're trying to accomplish things. And the drugs that are used are made to increase or reduce the effects of these monoamines. They're sometimes used to treat patients with psychiatric disorders, including depression, anxiety, and schizophrenia. Now, what scientists try to do in their research is figure out, well, what would happen if we inhibited the enzyme that's involved in the breakdown of these neurotransmitters. So in this case, inhibiting monoamine oxidase. So we talked about what a monoamine is. And so now this oxidase is an enzyme that's thought to keep the neurotransmitters around a little longer. So an example of some of the drugs that are created for this process is a monoamine reuptake inhibitor. And these medications include Prozac, Cymbalta, Wellbutrin, Effexor, and Paxil. These are some of the newer drugs. And in using these drugs, it does take some time to see improvement, 3 to 4 weeks. So it's not a cure-all, but it's one of the drugs. These are some of the drugs used to kind of target that particular mechanism. So next, we're going to talk about some antidepressants that are more commonly used. So you may have heard of the SSRI categories. These are popularly known as sertraline, fluoxetine, and the way these work is there's a concept that if the serotonin goes down, then symptoms of anxiety can be ever present. Some other names that might be familiar in this category are, we mentioned the Zoloft, which is sertraline, Prozac, which is fluoxetine, Paxil, Lexapro, Celexa. These SSRIs, which are known as selective serotonin reuptake inhibitors, are not to be taken with some of the monoamine oxidase inhibitors. So, in deciding what drug to put a patient on, one category has to be checked at a time. You can't kind of mix up different drugs. So even if you have access to drugs at home, some of these medications, make sure that you're not mixing them. And serotonin is one of those good feeling neurotransmitters. So if you can keep, in this case, you can keep it around longer, that is a way to try to address the feeling of depression. So let's try to keep around the serotonin longer so people can feel better longer. Of course, this isn't without side effects. And the common side effects are nausea, tremors, nervousness, problems sleeping, and sexual problems, which really discourages people from taking some of these medications. But it can be helpful for some. And more serious side effects include withdrawal symptoms, abnormal bleeding, and seizures. So, when you are in your doctor's office trying to decide if this is right for you, ask the questions to your doctor. Ask about side effects. Ask about, herbs that should be avoided. And I will talk a little later about some of the herbs that can be helpful. And some of these things are not to be taken at the same time. Sometimes herbs can be used to wean off some of these medications. So it's really important to be followed by a physician, and a physician preferably who understands those interactions if you plan on using natural therapies. So, with the MAOIs that we talked about before, so the monoamine oxidase inhibitors, commonly known drugs include the brand names of Parnate, Nardil, Marplan, and MSAM. And some of the common side effects with these drugs are nausea, dizziness, restlessness, drowsiness, problem sleeping. Less common but serious side effects are headache, stroke, fainting, heart palpitations, and blood pressure changes. So, of course, it is important to talk about some of these changes with your physician if it comes up, and you also should be started on a very low dose and monitored very closely to see if any of these changes comes up for you. More commonly known, and these drugs I call like the old school drugs. These are benzodiazepines, and these have been around for a while. Because of the side effects, sometimes they're not used as often nowadays, but they still are, there's still many physicians using them. They're used for anxiety, and long-term use actually contributes to depression. These include the category of some of the brand names of Valium, Xanax, Klonopin, and Restoril. How these drugs work is they are working on the GABA transmitter in the brain. So GABA is the most prevalent neurotransmitter in the brain, serving as a transmitter for 25 to 40% of all synapses in the brain. It's involved in the sleep-wake cycle, and it inhibits norepinephrine and helps to reduce anxiety. So you would say, well, what does anxiety have to do with depression? It's the other side of the coin. As I talked about before, certain patients who have anxiety, they can have it 1 to 2 years before it actually turns into depression. And this is really important, understanding that benzodiazepines, that overstimulation can actually contribute to depression, which is really important to keep in mind. So now, what are some of the strategies that can be used as far as depression is concerned? Here I'm going to start talking about a little bit about diet. I'm going to talk about therapy and also some natural supplementation that can be used. I pretty much tell most of my patients that they should have a psychologist on board. I say this because so many of us are walking around acting like we're okay when we're not. And it shows up in our lives. It shows up in our relationships, especially if in this time of year you start to feel down. A therapist can be really important. And Many people think a therapist is, only needed if you have a problem or there's something wrong with you. What I found is that a therapist can help to catch some of these feelings of sadness or anxiety that a person has before it gets out of control. This idea that we have, and I've spoken about this on other shows about just pushing through and, I'm fine, I'm fine, I'm fine, I'm taking care of everyone else, and then really neglecting yourself is a problem. It needs to be addressed. And earlier, I talked about the prevalence of depression with women more so than men. And many times because women are the caregivers and they don't take care of themselves and they make sure everyone else is okay without looking at themselves. So what is the difference with, different health professionals as far as therapy is concerned? So there are lots of different healthcare professionals that you can go to deal with depression. I'm going to talk about the main two. There are licensed therapists. There are people who are social workers who do therapy, licensed social workers. And mainly, I'm going to be talking about psychologists versus psychiatrists. So, what is the difference between the two, and why would you seek one out versus the other? The main difference is a psychologist completes a PhD doctoral program, and a psychiatrist is actually a medical doctor who focuses in the area of psychiatry. The difference, if you are someone who's interested more in medication, a psychiatrist would be managing your medication. Many times nowadays, there are nurse practitioners who are involved in this process. And I like to think that a psychologist has more of a holistic approach in that. And by that is what I mean that there's a lot more testing that's done to kind of see where the patient's at, looking at their whole picture. And whereas a psychiatrist, some of the benefits of that, because it's a medical doctor, that person can see what other illnesses may be going on that may be contributing to depression. So it's not a better situation in this. It's more so what strategy works more so for you. If you're someone who is a little hesitant to be on medications, a psychologist might be a better approach for you. So those are some of the people involved that can be helpful. As I mentioned, seeing any kind of therapist is important to see them regularly. Sometimes people think, oh, well, I'll just see a psychiatrist or psychologist anytime. No, it should be something that's done once a week, especially if you're dealing with something like depression. And especially if you're seeing a psychiatrist, they can monitor your medications and see how you're doing. A psychologist will really look at what are the other factors going on in your life that can be contributing. What are those issues that you've had over time that have presented themselves, many times unresolved issues that haven't been looked at. And one of the reasons why therapy and this topic is so important to me, because I was a mental health counselor many years ago. And while I was doing that, it really highlighted to me how many people are suffering with mental health disorders. And also, I was able to see in this particular case, there were MICA patients that I was working with. So they are mentally ill, chemically addicted adults. So the difficulty in dealing with a mental health disorder along with addiction, I mentioned earlier that the opioid crisis is as an all-time high. Everyone knows about this. Everyone's aware of how it's affecting our country. And many times it's disorders that aren't properly looked at. People are just going on with their lives, suffering in silence. So it's very important to me to talk about mental health. I do lots of presentations on it because it's really important. And I say this all the time, your patients won't get better if you ignore their mental health issues. It's just not going to happen. So I will tell my patients if they present to me and they have feelings of anxiety or depression, I make it mandatory that they see a therapist. Natural modalities can be extremely helpful. But at the same time, if you're not seeing a patient every single week, you're not able to see other things that may come up that need to be addressed. So I implore you, if you're having feelings of depression, anxiety, to look for a therapist and don't give up. Many times people will see one person and they'll say, oh, it's not for me. Or sometimes there are cultural beliefs that say, I shouldn't see a therapist because it goes against my, what my culture says, or some churchgoers are led to believe that therapy is against what God would want. All of these are things that come up. If you feel more comfortable, see your local pastor at your church, but someone needs to be on board where you can discuss these things because you can't hold these things inside. So the next topic we'll talk about is happy foods. Many times people are interested in what they can do as far as diet to feel better. Um, Also, other people don't even believe that food has such a strong power against mood disorders, and it does. What you consume affects every aspect of your health. And as I mentioned, mental health cannot be ignored. So, how can we promote positive outlook, positive mood through diet? Well, the World Journal of Psychiatry released a study of the most nutrient dense foods to prevent or promote recovery from depression. And with this study, vegetables actually topped the list at 48%, followed by organ meats at 25%, fruits 20%, and seafood at 16%. Deficiencies of certain nutrients, including omega-3 fatty acids, B vitamins, zinc, magnesium, and vitamin D, can cause depressive symptoms. So look at that. Vegetables top the list. And if we talked about SAD before, seasonal affect disorder, but there's another SAD, and that's the SAD diet of most Americans. If you're not consuming enough vegetables, you're not getting in many of these nutrients that are needed to have a positive outlook towards health. Um, I love that this study was done, and there's more studies being done. There's actually a lot of studies talking about diet and nutrition and how that affects depression. Why? Because, like I mentioned, depression is not well understood. So we need to look at all the mechanisms that are involved with depression. So nutrient deficiencies, what's going on with that? One of the first things I do with patients when they present to me and say they have anxiety or depression and they want to go a natural way, I look at nutritional deficiencies. There's certain patients, their B vitamins are really, really low. Their vitamin D is low, and these things are associated with cognition, having lower positive mood. So it's really important that you take a look at these things. With omega-3s, if you're not familiar, these are what we call the good fats that you consume in your diet. They have seen in certain studies that those who experience depression may not have enough of what is called EPA and DHA. So these are the two main omega-3 fatty acids, and they're mostly found in animal foods primarily, but they're also found in plant foods as well. And the difference is that with the animal foods, if you're consuming this with eggs, meat, dairy, grass-fed beef, or cold water fish, it's easier for certain people to convert into the EPA and DHA. It's already kind of formed in that way in those particular animal-based foods. But the plant foods don't do too shabby as well. So the plant foods include flax seeds, chia seeds, hemp, walnuts, pecans, most nuts and seeds, leafy greens, the cabbage family, and algae. So if you ever look at plant sources of omega-3s, many times the vegan version of like a fish oil supplement will be using algae. So you can add in more omega-3s in your diet through food, but you can also take fish oil supplements or the vegan version algae supplements. When my patients are low in these or they are dealing with depression, I definitely put them on the fish oil supplement. The only risk that I would say is that if you're on blood thinners, you have to be very careful with fish oil supplements as they can thin the blood. So natural supplements can be very helpful because you're targeting this idea that the depression, basically not having enough omega 3s isn't doing you any favors. So it's very important to get them in your diet, not only for depression, but I tell certain patients who are interested in vanity purposes, it's good for skin, it's good for hair, keeping all those things healthy and shiny. So that's another way I can get people to take those omega 3s. The B vitamins, so we spoke about before about some nutritional deficiencies. B vitamins, including B6, which is a cofactor in creating dopamine, and B12 is involved in the body's methylation process. So if you don't have enough B vitamins, then your body can't create some of these neurotransmitters as efficiently. B12 is used in so many metabolic processes in the body. So if you're low, which many of my patients are, it's going to make it a lot harder to process certain nutrients in the body. And also, this will affect your cognition and mental health. As I mentioned before, it's important to have a blood panel that includes things like vitamin D and B12 folate prior to putting someone on a antidepressive medication, because sometimes understanding this relationship between mental and cognitive health, if someone's low, they may be expressing symptoms of having depression when they're really low on nutrients. I've definitely seen this in some of my patients, and as we use we take care of these nutritional deficiencies, they feel better, they feel more alert, they feel more happy. So it's important to understand the difference between nutrient deficiency and actually having depression. These vitamins and nutrients are important for neurotransmitter synthesis and neuronal function. So that's another way we can target some of these symptoms. Minerals can actually help regulate membrane function and neuronal excitability. The mineral lithium has a long tradition of being used in psychiatry. Kind of controversial, but it's actually a mineral that was used as a medication. Not so much used nowadays, but it's definitely worth mentioning. Magnesium has been shown to be a mood stabilizer in high doses. So many people know about magnesium as being relaxing to the body. And it's also in those higher doses is known to be a mood stabilizer. What's great about magnesium is that it's safer. Pretty much if you're taking high doses, it will make your stools loose. That's about the worst thing that can happen with it. Magnesium is used for restless leg syndrome, overall relaxation. So sometimes patients feel a little better being on magnesium. Inositol was known as a B vitamin. Right now, they're recategorizing it. It actually is a cell signaling carbohydrate that's present in secondary messenger cells. And right now, there's a lot of research being done on large doses of inositol being used for treating depression. So how can we use this safe carbohydrate as far as with depressive symptoms? As I mentioned before, certain conditions must be ruled out before diagnosing depression. Some of these include hypoglycemia. Like I said, if someone has low blood sugar, their energy level will be depleted. They might act differently. For these people, these patients, it's important to stop alcohol use, coffee, sugar, anything that's going to alter the blood sugar in the body, increase proteins and complex carbohydrates, and also eating small, frequent meals. I notice certain patients with food allergies can feel so bad as far as what foods they can or cannot eat. And as a result, they can mimic symptoms of depression. Also, a really important thing to discuss is having hormonal changes that can cause depression in patients. So, a lot of women with menstrual disorders will have a condition called premenstrual dysphoric disorder. And along with this comes extreme sadness, hopelessness, irritability, and anger. For these patients, every month they have their menses, they just go in a rage. I had one patient who told me about how frustrating that is because it was affecting her relationship. With some of these patients, B6 can be helpful. Sometimes adding in a little bit more carbohydrates, managing that along with the protein, the good fats that I mentioned before, those omega-3s can be really helpful. Just overall, B complex, having all the Bs together in one supplement can help with the synergistic action of the B vitamin. So they're helpful, and sometimes it's useful to use individual B vitamins, but using them in a B complex I found to be very helpful for some of these patients who have what's known as PMMD, which is the premenstrual dysphoric disorder. Also, what do you do with a patient who has depression during pregnancy? That's a very scary proposition. Many of these medications are not recommended for someone who is pregnant. So again, very important to look at, is this person dealing with a thyroid issue, which can mimic depression or anxiety sometimes. Just taking a look at that patient and seeing if there's nutrients that they may be lacking, like B6. Supplementing with B6 and zinc can be helpful for patients during pregnancy, and that's also not dangerous. Sometimes postpartum depression is also something that needs to be looked at. For those patients, they might also have a nutrient deficiency. If you think about it, when a woman's pregnant, the baby is causing them to require is using up so many nutrients in the body. There's so many changes that are happening hormonally that can change things and trigger certain things. So these patients is especially important to take a look at if there's possible nutrient deficiencies before and after pregnancy. Now, what are some physical things that you can do to beat depression? Exercise. So those endorphins that are coming about from doing exercise can be very helpful with depression. Now, the next question would be, how do you get a depressed person to work out? That's a very difficult proposition. If someone feels like they don't even want to leave the home, how can you get them to go out and be physically active? It's really just trying over and over again to get the person to move, checking in on people. If you're someone who feels a little down, try some exercise. Try to get to the gym where you're around other people. Maybe that energy from others can help stimulate you to keep moving. Once you get nutritional deficiencies taken care of, that can make you feel more alive and make you want to even leave the home and exercise. So that's why it's important to look at the different factors to get you to the point that you can now exercise. Yoga's been very helpful with working out mood disorders. Using yoga in conjunction with looking at if there's any other things that need to be addressed. If you're using yoga, that can help encourage positive mood. Tai Chi and martial arts. Those are a little bit more aggressive, but what's great about those is it gives the person something to do, a way to be active, something new to try. Tai Chi is very calming to the body, and is also being studied with how it can help with mood disorders and depression. So let's talk a little bit about some helpful herbs that can be used. The most popular, of course, St. John's wort. St. John's wort works on, it has a serotonin reuptake inhibitor-like action, which is also helpful for pain management, which is important when we're talking about chronic pain. Many people with chronic pain feel depressed. A lot of my patients with autoimmune diseases, they feel very down and depressed. So something like St. John's wort, if they aren't on another medication, is always great to try because it mimics the SSRIs that we talked about before. So they should not be mixed. Photosensitivity and contraindications with drugs are the most important thing to look at when you're talking about St. John's wort. Rhodiola is another herb, and it increases the levels of monoamines that we talked about before. It has anti-inflammatory properties, so that's helpful as well. Some newer research is showing that there is an element of inflammation when in discussing depression. So that's some more research that's happening. With rhodiola, there was a study by the Nordic Journal of Psychiatry that demonstrated overall that showed that depression, insomnia, and emotional instability was decreased on rhodiola. The only thing to be aware about with that is too high of a dose can potentially cause irritability, insomnia, or agitation. 5-HTP is pretty popular. I use that many times with my patients. It's a precursor to serotonin, so it shouldn't be taken with the SSRIs, or it can cause serotonin syndrome. Again, serotonin is more of a happy neurotransmitter, so if you give the body the nutrients, hopefully that can create more serotonin. So that's how 5-HTP works. And then SAMe, that's gaining more traction as far as being used with depression. And the way this works is that it's a cofactor in the development of serotonin. One other thing that is important to talk about as far as natural things that you can do to fight depression is acupuncture. I love acupuncture. I love using acupuncture with my patients. I definitely have seen how patients can feel better while doing acupuncture. And the more recent studies are done on a particular type of acupuncture using stimulation of the vagus nerve. So auricular acupuncture, when you're getting the acupuncture needles in your ears, there are actually different protocols that are used that can be helpful for anxiety and depression. The vagus nerve, it's also known as the winding nerve because it connects the brain and the immune systems together. The vagus nerve plays a crucial role in helping to connect those two systems together. And so they call it transcutaneous auricular vagus nerve stimulation, and also known as TAVNS. And this was seen in research to be a safe and tolerable treatment for depression. More studies are still going on, but I think this is a great tool to use for patients who are struggling with depression, whether or not they're on medication. It's definitely useful. And how it works is the acupuncture points stimulate the auricular branch of the vagus nerve. The auricular branch of the vagus nerve projects to what's called the nucleus tractus solitari, NTS, and that is further connected with other brain regions. So that is how acupuncture can be helpful by targeting these areas in the ear. You're connecting into that particular branch of the vagus nerve. The vagus nerve has direct and indirect connections to the depression-related cortical, limbic, thalamic, striatal neural circuits, and that influences the activity of these particular regions in the brain. The auricular points used for depression are actually located within this area of vagus nerve distribution. So we talked today a lot about depression, what it is, the medications used, the natural therapeutics. And I hope this information is going to prove to be very helpful to you. It's important to take a look at what your mental health is at this particular time of year, especially. I mentioned earlier that there are some resources that can be helpful for depression. So I'd like to point out that if you are in crisis and need immediate support or intervention, please call or go to the website of the National Suicide Prevention Lifeline. This number is 1-800-273-8255. They have trained crisis workers who are available to talk to you 24 hours a day, 7 days a week. And also in conjunction with that, Substance Abuse and Mental Health Services Administration, that is a treatment referral helpline, 1-800-662-4357. SAMHSA is what it's known for, also has a behavioral health treatment locator. So you can go there and look to see what resources you can find in your area. I've posted these resources on my website, drjpierre.com, drjpierre.com, just in case you've missed anything, because this is really important to me that you make sure you have these resources. I've also listed local therapists that may be helpful for you as far as looking for someone who can help you with those symptoms of depression. That is what I wanted to share with you today. I hope you have a wonderful and blessed holiday season. I hope that it brings you joy and happiness, and you take the best steps possible to make sure that you're taken care of if you need it.
You're listening to WPKN Bridgeport 89.5 FM and online at